Good morning, good afternoon, good evening, and good night, friends and colleagues from across the world. Today we have a special edition Podinar with Dr. Shervin Molayem. Thank you for joining us today.
Thank you, Dr. Shah, for having me.
It's very exciting to finally get some time with you to discuss this new innovation that dentistry today calls the AI revolution in dentistry, TrustAI. So we'll make the audience become familiar with this project that you're working on and also ask you a host of questions today. Just some housekeeping stuff. We are well into the London event for artificial intelligence. It's to be essentially consortium where all medical and dental doctors can create this bridge that we much need, given things like predictive analysis, so we can collaborate more closely together with our medical colleagues. But also, there's going to be a ton of innovation there, networking events. The top docs are coming out. We're inviting about 1,000 of them. Various heads of organizations. There's currently 8 partner organizations participating with this, from the Society of Physician Entrepreneurs down to the International Academy of Dental Facial Aesthetics and others. Our British counterparts, Tipton Academy, and our Saudi counterparts will also participate for the entire GCC. So this is a global event. I strongly urge you guys to look into and participate in. And the URL for that is globalsummit.amores.it, and you'll find all the information that you need there, from vendors to speakers. I believe there's currently about 50 speakers, but I expect that to double in the next couple of weeks as our medical friends and colleagues are rolling in. So this event promises to be the most important event in artificial intelligence when it pertains to healthcare in 2026. So pick up the early bird if you can. This is a way for us to come together and learn. There's a lot of you that don't know where to start in AI, and a lot of you guys are advanced. There's a place for everyone on the dental team or the medical team and the entire supply chain of the healthcare industries to participate in this very unique event put together by the Global Summits Institute. And okay, with that said, that's all the announcement I have for today. We're gonna get started with this most amazing concept that's got me very excited. I'm gonna play you guys a video to draw a picture of where this is all going with dentistry. And for those that embrace technology and innovation, which is inevitable, you will find this very exciting. Just imagine your day would start this way and go on with the
Doctor AM is Sarah Martinez, here from Crown Prep on 2014. I've reviewed her radiographs from last week. The decay extends subjectively on the distal. I recommend a crown lengthening consideration. What's your medical history like? Controlled type 2 diabetes, HbA1c of 6.8 within the last 3 months. Amoxicillin allergy documented.
Welcome, Dr. Rogers. I have 12 patients today. I verified everyone's insurance overnight and rebooked 2 patients who canceled for next week.
Let's make it a great day. I think we should review Sarah's radiograph for my analysis. I think help me create a competent plan for Sarah. We'll have to proudly think I did the law service. I would be happy to answer any questions about the procedure.
How do you document so fast?
The stock by the price. I think, what's the latest research on PRN extraction sites?
Dinner is ready.
This AI's got me hooked. Coming soon.
How amazing. So, this is a topic we'll discuss today. This is, and we will look at all of the aspects of this step by step. Just to become a little familiar with our speaker today, here is, it would take me a long time to read all of the credentials, but here we have a short version of it. He's a California-based periodontist with 15 years of private practice experience, specializing in oral systemic connection, gum and implant surgeries, and advanced dental technology. A graduate of UCLA Dental and USC Periodontics, he's known for establishing the mouth-COVID connection and developing innovative AI solutions. His work includes the groundbreaking AI periodontal probe and a patented AI-driven treatment planning system, which led to the co-founding of TrustAI, which is the world's first AI native dental patient management software. He's also a co-founder of Peridental, the first traveling specialty dental group, and serves as a board member of Cloud Dentistry, the largest dental staffing platform in the country. As chief dental officer at Oral BioLife, he's focused on revolutionizing bone restoration with a non-surgical approach. He consults with dental startups, advises on periodontal and oral health products, and hosts the Dental Innovation Lab podcast. He also serves as a liaison on the Dental AI Association's Innovative Committee. So, Dr. Molayem, that's quite a career you've had. Welcome.
Thank you for having me, Kianor.
So tell us, what was your motivation to get Trust started? I've seen you speak and present for a couple of years now involving these kind of topics, and then suddenly all of it came together for you to start Trust AI. Tell us a little bit about that. What's the story?
Well, I actually this started back in when I was in my residency. We had a class that was called the Perio Pros Treatment Planning Seminar. Every Thursday morning, the Perio residents and the Pros residents would come into a room, and we would switch off taking turns giving a presentation of a full mouth reconstruction case. And that room, what happened there was like a war zone where the not even the faculty, but the residents would come and ask questions to the speaker. Quote me why did you do this technique? What happened in the article that you're talking about? Anything and everything was fair game. And some speakers would cry. It was just really brutal. And I always thought to myself, like that's dentistry. That's the most complex cases. You can get any question. You have to have, research to back everything that you're presenting. Then when AI came about, I got involved with different AI companies. I started advising and investing and really embracing technology in general. And what I found was that what if there's an AI that could actually have all the research, have all the photos, have all the radiographs, and be able to be that person on the stage and answer any question that is coming out someone who's planning these cases. So that's where it kind of started, and it's developed into really different AI components that are part of one patient management system.
Wow, you've had an amazing career. Please note that most of the audience is very, very new to AI. From the lectures that I've recently observed, they don't know where to start. So we're gonna kind of break it down for them. So since you conceived this idea and started building it, um, what areas? I mean, the video showed us how our life could improve by having a second hand next to us at all times. What areas would you say that Trust AI immediately helps clinicians that are still working on manual or similar means?
Yeah. So when you think about it, you want to solve patient problems, right? There's different pain points throughout the day that are just, tiresome, annoying, and kind of busy work. So for example, in insurance, your staff is picking up a phone, calling, verifying insurance, holding on the phone for 15 minutes. Or you can, not just replace your receptionist, but you can, make them half receptionist and half biller, and half, you can have someone doing all these different tasks because you have an AI receptionist. And then, what we focus on more is the day-to-day, or patient-to-patient, I should say, decision making, right? Dentists are constantly making decisions, and they don't have access to all the latest research. If they have a difficult case, they have to go maybe call a mentor, go to a CE class, learn about it. Whereas this is real time. You can access information about your specific patient right then and there, which is very powerful. And if you could trust the recommendation, then even better.
So insurance verification, I saw you guys just added to your platform, which is incredible how at what rate you guys have connected to all the insurance companies. But also other things like case acceptance. When the intraoral came around, people started accepting cases more because they could see what we see. Now having the AI in the background analyze the X-rays and spit out a report in front of the patient, having a conversation with you, I think would just add to that, no?
Yeah, one of the things we have a big problem in our field is the trust. Patients trusting the dentist's recommendation. Uh, if you look at the comment section on posts on Instagram and Facebook, when anything is dental related, I urge you, go to the comment section, and if you see it, if it's a non-dentist community, you'll see comments like, I went to the dentist, they said I had 5 cavities. I went to another dentist, they said I had one. My dentist did this. There's a lot of different things that people experiences that they've had. So there's a mistrust. They don't know what's going on in their mouth. And there is actually a benefit from having this second opinion, or as we like to call it, the thousandth opinion, because this AI has been trained on thousands and thousands of cases.
Amazing. Okay, I completely agree with you on this regard. So, how far are you guys into it? I mean, I understand you have created a scenario where you can purchase apps to as add-ons. Like if I wanted to be in my car and have my entire office with me in my vehicle, I could add on that add-on. What else are you guys working on? I'm just interested.
We've created an add-on, for example, an implant identifier. So you don't have to go anywhere else. You just have the X-ray already in your system. You just click it, it'll tell you exactly what implant company it is, and things like that. I don't want to give
Those
away
things
too
that are
much, but yeah,
extremely annoying and you have to call different companies and chase it down to an
yeah,
expert who can identify that implant,
yeah, yeah.
is quite a task at times in the office. Well, okay, so Dr. Shervin, I'm gonna let you get right into it. I might have additional questions as we go along. So, with that said, you can have the floor, and I'll be in the background learning. Also, please mention the special to our viewers that you guys are offering for all of our colleagues that want to try this out. And before we jump into the presentation, I have one more question with you. There's a lot going on in the AI industry now with integration. Everybody's like, how can I get the system integrated into my management software? And there's so many systems trying to integrate with one another. What's Trust's plan to be compatible with everyone so everyone can use it? Is it need to be fully connected to the management software? Are you guys going to have your own management
Yeah,
app so you can
yeah.
schedule patients? How are you guys going to handle that?
Yeah, so it's really not about how we're going to handle it. It's the future of dentistry is not uh, so many different companies integrating with each other, because that slows down AI. It has to be in one system, and it's seamless when you all have everything in one system. So whether it's us or another company, that is where we're heading. For maximum AI potential, it has to be all in one system.
I agree. This should be very exciting because it's like the wild, wild west right now. You have some management softwares not wanting to integrate certain companies because they already have established relationships with a competitor. and people are purchasing it, and the management software doesn't accept it. It's a big mess.
Yeah, yes, it is.
I think
Yeah.
you're correct. All right, thank you so much. This is exciting. I look forward to learning from you and be in the background. Thank you, doctor.
All right. All right. So first, let's start off with calling our AI. His name is Isaac. So I want you to meet him. So let's give him a call.
Hello, Isaac, the TrustAI Dental Co-pilot. How can I assist you today?
Hi, Isaac. I'm in the office right now, and I'm trying to look for an intraoral scanner to buy. Could you give me some recommendations of the top ones?
I'm here to assist with dental clinical challenges. What specific dental case can I help you with?
Okay, if we want to do dental questions, I have a patient here that has taking Coumadin, and I don't have a medical clearance, but their INR is 1.5. I want to know, do you think I could still treat this patient or not?
I need to verify to ensure I provide accurate information. Please hold on for a moment. I couldn't find any information on the term incumbent.
Oh,
You mentioned
Coumadin,
something else.
the warfarin or Coumadin.
Thank you for clarifying. With an INR of 1.5, the patient is generally considered to be within a safe range for dental procedures, as it's below the usual therapeutic range of 2 to 3 for patients on warfarin. However, it's still important to consult with the patient's physician to confirm that they are
Okay,
stable.
Isaac, I
Get
just bought
medical-
Isaac, I just bought a new cone beam CT scan so I can treat airway cases and sleep apnea. I'm trying to figure out and still learn how much airway space am I looking for? How many millimeters?
When evaluating airway space using cone beam CT for sleep apnea cases, the minimum cross-sectional area that is often considered adequate is around 100 millimeters squared. However, this can vary based on individual patient anatomy and clinical judgment. It's important to integrate these findings with clinical symptoms and other diagnostic criteria.
Isaac, I have a patient want to extract the anterior maxillary tooth. Could you give me the steps for a traumatic extraction?
For an atraumatic extraction of an anterior maxillary tooth, follow these steps. First, administer local anesthesia to ensure the patient is comfortable. Then use a periotome or luxator to sever the periodontal ligament fibers around the tooth gently. Next, apply a small amount of force with forceps. Luxate the tooth, avoiding excessive pressure that might fracture the bone. Finally, use controlled and gradual movements to extract the tooth while preserving the surrounding bone and soft tissues.
How about with a canine? Sometimes I have trouble because the canine is such a long route. What do you recommendation do you have with a canine extraction?
For extracting a maxillary canine, consider sectioning the tooth to reduce the risk of root fracture. Begin by making a vertical groove on the buccal aspect to weaken the tooth structure. Use sectioning to divide the tooth into 2 parts, if necessary, making it easier to remove each section separately. Employ careful luxation and elevation techniques, using periotomes or luxators to minimize trauma to the surrounding bone. Patience and gentle manipulation are key to preserving the alveolar bone.
What about the socket shield technique? Is that a good way to take out a tooth and put an immediate implant?
The socket shield technique can be effective for immediate implant placement, as it preserves the buccal, bone, and soft tissue architecture. By retaining a portion of the buccal root, it helps maintain natural contour and prevents resorption. However, it requires precise execution and careful case selection.
Are you able to
It's
send me any research article to my email on that?
I can search for the latest literature on the socket shield technique. This will take a few seconds. Please hold on. I found recent research on the socket shield technique, highlighting its benefits in preserving buccal bone and enhancing aesthetic outcomes. To send these articles to your email, I'll need your 4-digit verification code to verify.
3851. That's my last 4 digits of my phone number.
Sending the research articles to your email now. I've sent the research articles on the socket shield technique to your email. Is there anything else I can assist you with?
Great, thank you. I just perforated the sinus, extracting a maxillary first molar, and the root tip it got stuck in the sinus. How do I manage this case?
In the case of a sinus perforation with a retained root tip, it's important to first ensure that the patient is stable and not experiencing excessive bleeding or discomfort. Then consider referring the patient to an oral surgeon or an ENT specialist.
What if I want to handle it? What if I need to handle it myself right now? What recommendation would you have?
If you need to manage the situation immediately, ensure the patient is seated upright to minimize sinus pressure. Irrigate the area gently with saline to help visualize the root tip. Using a sinus lift instrument or small forceps, carefully attempt to retrieve the root tip without causing further trauma. After retrieval, consider placing a collagen membrane or gel to aid in sinus healing. Prescribe antibiotics and nasal decongestants as needed, and advise the patient to avoid actions that increase sinus pressure, like blowing their nose. Follow up closely to monitor healing and address any complications.
Got it. Isaac, I have a patient here that has a 5 millimeter pocket after scaling and root planing. I've been, this is a patient that's been in the office for a few years, and we're recommending scaling and root planing, but they think that they just need a prophy. How would you explain this to them in order for them to accept the treatment plan of doing scaling and root planing?
You can explain to the patient that a 5 millimeter pocket indicates gum disease, which can't be effectively treated with a regular cleaning. Scaling and root planing is a more thorough cleaning that removes plaque and tartar from below the gum line, helping to reduce inflammation and prevent further bone loss. Emphasize that this treatment is essential for maintaining their oral health and preventing more serious issues in the future, like tooth loss. Reassure them that the procedure is a proactive step to preserve their smile.
Got it. I have another patient that seems not to trust the fact that we need to place bone graft after the extraction. Could you explain it to them that it's necessary to put the bone graft at the same time as the extraction and why it's important?
Explain to the patient that after an extraction, the jawbone can begin to shrink and resorb, which may compromise the stability and appearance of future dental work. Placing a bone graft at the time of extraction helps preserve the bone structure, maintaining the natural contour of their jaw and providing a solid foundation for future restorations, like implants. This proactive step supports long-term oral health and aesthetics, ensuring that any future dental work has the best possible outcome.
All right. Thank you, Isaac. All right. So that's a little demonstration of the chat version, and I will start the presentation now.
Those are very fantastic questions. We often get in trouble and panic sometimes and don't know what the right next step is. So this is good to have that tool handy.
All right. So as you met Isaac, he's the world's most advanced clinical intelligence partner, trained on dentistry and built to make treatment planning faster, more accurate, and more evidence-based. So whether you're a new grad or a professor, he is the clinical expert we can rely upon anytime and anywhere. And he's available 24/7 in different languages, almost every language. And we're seeing that being used all over the world right now. I'll get into that in a moment. So this is the video that we were showing. But our mission is really simple: to bring specialists, clinical insights to all practitioners. The days of hoarding information, keeping information, to ourselves is over. With AI, as you know from ChatGPT, everyone has access to information of all types, and it's time for really everyone in the world, every dentist, hygienist, front office person, to have that same information and be able to interact with a co-pilot, which is really exactly what it sounds like, a co-pilot. It doesn't replace the dentist. It just aids and augments their own decision making. We don't want to just get rid of everything that they ever learned and just say, hey, trust exactly 100% what this AI is saying. That is not what this revolution is about. This is about making dentists' lives easier, faster, better, less stress, and no replacement. We want to keep the human touch. We want the empathy. We don't want to replace the conversation with the dentist, with the patient, the look in the eyes, the explanation. So this is a lot of it is if the AI shows them something or tells them something, is we follow it up with our own analysis and explanation. So we want to democratize clinical excellence and really all across the globe. And really the problems right now, the pain points that we have as dentists are lack of access to a mentor at the right time, lack of efficiency in assimilating all aspects of a case. So whether it's an endoperio case, a periopros case, it's really bringing it all together, all the specialties in one. Inconsistent diagnosis and treatment planning. So an example of that is there's a someone that in New York, he published an article on this that went viral. He went to 10 different dentists and got 10 different treatment plans that range from $0 to $100,000. So when patients see this, like, hey, I went to this dentist, I got this plan, I went to this dentist, it brings a lack of trust in dentistry. And there shouldn't be one plan either. There shouldn't be 10. So somewhere in the middle, there should be, maybe 3 plans, one aggressive, one conservative, one band-aid approach, one on a budget, that type of thing. But it shouldn't be all over the place. And lack of standardization in clinical decisions. The need for support and second opinions in complex cases, improving the public opinion, which we just talked about, bringing trust in dentistry. That's why really the name of the company is called TrustAI, because we want to restore that trust in dentistry. Having said that, what we recommend and what anyone ever recommends is never 100% correct. Nothing in life is 100%. So that's why we created something called the Trust Score, which is a score that we're giving for our recommendations for our treatment planning cases that is a confidence interval or a percentage. So let's say it spits out and it has a treatment plan or a diagnosis and it says 85% trust score. So as a dentist, the new way we're going to have to think about it is, hey, this AI been trained on this many things is 85% confident in this. Another time you might see 50%. And so anything that's really below 75% is not really that trustworthy. So you have to take it for what it is. But if you see something in the 80s, high 80s, 90s, then you can lean on it a little bit more. So we have to use our own judgment. And one of the things that we believe that will help with all of this is a trust score. And also the fact that we can't, be everywhere. We can't be in the office, take CE classes, go to study clubs. It's hard to travel to go to different conferences. We're coming out with a lot of debt from dental school. And so this is really a way to get it right away in our office, the information. Now, this is an actual, there are so many of these that I've seen, but this is an actual patient that said, dentists are lying, retards, scam artists who torture kids. Like, this is a dentist got this message. So things like this, there's a lot of mistrust. And we talked about some of this. And the other thing that we're going to talk about is the technology fragmentation. So when you're paying for 7 different subscriptions, 7 different, you have your AI receptionist with this company, you have your insurance verification with that company, you have your PMS with this company, all of these things, they're fragmented and they're only integrating on the back end, but they're siloed. Their data is actually separate. So for AI to function really, really the way we're going to want it to be, it has to all be connected and in one system. So the solution here is what's been dubbed as the ChatGPT for dentistry, meaning ChatGPT is because you could upload in ChatGPT different, PDF file, PowerPoint file, photos, text, and it could take all of these modalities, analyze it, and then you can act as a co-pilot and ask it any question about that case, about that situation. Now, this is similar in that we have all of the patient data from medical history, dental history, radiographs, intraoral photos, later on blood tests, genetic tests, salivary tests, and be able to pull it all together in a one system co-pilot. We have a voice version, which you guys just heard. There's a chat version. We're coming out with an app soon, which we've created already. It's just being released maybe in the next month on Android and Apple. And one of the things that we also want to do is create a clinically rich narrative. So it's like an explanation of exactly what's going on in that X-ray or in this case. And we're going to talk about one of the things that is very important is reducing hallucinations by providing safe guardrails. So really, there's different layers to this. You have the diagnostic aspect, you have the interactive clinical support, you have a PMS integration, you have the treatment planning, and then real-time knowledge. And right now, we're moving into phase 2, where the fourth quarter of this year, we're going to be releasing our PMS, our full PMS, which is an electronic health record, patient management system that can do from A to Z. Do your prescriptions, do your billing, and have all the data in one place. And then after that, we're going to be going into more of like workflow, complete practice orchestration, and also smile design, which we'll be able to take a picture of a smile and then be able to treatment plan a smile design from that. Our chat version, which is both in text and in voice, it's like you heard, quick question answer. You can track all your conversations. It has memory. A lot of this, keep in mind, just like ChatGPT or Claude or Gemini, it has memory. So it starts to know who you are. It knows if you're a newer dentist, if you're a holistic dentist, if you're a dentist that is been working for 30 years, it will treat you as such because it knows your level of expertise. And then one of the things that we're going to be, as dentists, having to learn is how to prompt it to maximize it. What questions to ask it to get the most out of it. So you could ask, for example, act like a expert endodontist and tell me, how you would treat this case. What is the success rate of a retreatment on this abscess that looks like this, that's near the sinus, that has no buccal bone, that has a class 1 furcation, class 1 mobility, and needs a root canal and a crown. So specific. The different research are more, papers are more general, like retreatment of an endodontically treated tooth is 78%, let's say, success rate. But that might be a lesion that could be small, or it could be a lesion that's big. So when you have your own patient's data in there, the AI is going to be able to give a better percent. You could ask it, what's the chance of this tooth surviving for 5 years? And it'll be able to predict and give you a better answer, which is really fascinating. This is another version of the chat. You'll see a question was asked and an answer. So this is like kind of like the ChatGPT version of TrustAI. We are also on WhatsApp. So a lot of people like to just use, go and add add Isaac as a friend. So I put him in your favorites. And then whenever you have a question, you could just go in and ask a question and it gives you an answer. So that's been very, very popular as well. The audio version, which you've heard, this is the audio version is, you can go very deep. You could interrupt Isaac in the middle of a sentence and he'll stop and focus on what you're saying, and you can guide the conversation to where you want. Uh, you don't need to listen to the whole thing. Sometimes at the end they just say some, some generic things. Just move on to the next thing, and or even to the next topic. So a lot of people ask us, what's the difference between TrustAI and ChatGPT? Uh, Let me scroll this. So we're a purpose-built AI, which speaks dentistry, and it's built by dentists for dentists, and it's trained on dental literature, on clinical protocols, real-world case studies. We have algorithms, safeguards, really to bring as much trust, and we also created a way where we get human feedback in the loop. So whenever there's a recommendation, there's a thumbs up or thumbs down, we go through the ones that are thumbs down and say, okay, why did this person not like this answer? And how can we make this answer better? Right? Because the whole point of this is to always get better, improve upon, to give a better quality product. We are on a FDA certification pathway, and as we talked about our algorithms, which is really our proprietary ways of how we are able to create this. So again, we're a specialized AI. We're not general. We're validated with clinical accuracy, within integrated chairside workflows, and HIPAA compliant and secure. So ChatGPT just recently released these numbers of their different models, where they want to basically let people know that they've improved upon their hallucinations. Hallucination means they have some inaccurate information that could be completely off. And we know in healthcare that's a big no-no. One of the things, if you have a device that you're trying to get it FDA approved, you can't have a device that's 3% of the time wrong or 2% of the time wrong. Because that's, 2 out of every 100 people that might get a very, very bad outcome. And so you can see their models went from 15.8% to 12.9% to 3.6% to 1.6% with thinking. They have a feature that says make it think longer. And with TrustAI, we've, according to our data, for going through 50,000 chats that we've had thus far, we only have a 0.1% hallucination rate. So that's where we want to be. You have to be as close to zero as possible. And that's where really we have to strive, get as close to zero. Maybe next time we can get to 0.05%, maybe, but we're really trying to get to that zero mark as close as you can, but you can never get to zero. There will never be a time where there is a for sure guarantee of zero, but we have to get as close to zero as possible. The next thing, a feature that we have, is a SOAP note or scribe note, which documents your consultations. And we all know that takes a long time at the end of the day when we're tired. So when you come into the office to the your chair, you click a button that starts recording. You may have to have your patient sign a waiver before, like your new forms may need to say that I'm okay with my conversation being recorded. And then you could even put your template. If this is the way that you like your notes to be, you say, make all my templates, all my conversations look like this template afterwards, and it'll do that. And so you come here, this is what you would see, start recording, and you could either do SOAP notes, which is the SOAP format, or you could just do regular clinical notes or whatever your template is. So this is a conversation that they had with the doctor and the patient, and then it turned it into this note. This is the actual SOAP note. So it organizes it and really makes it easy to understand. We're working on a perio charting transcription, so the hygienist or the dentist could just be probing and say 3, 2, 4, 4, 3, 3, and automatically get input. And then really the magic happens here. This is the user interface. This is where everything comes together in one. It's where you plan your cases. It's where you diagnose and treatment plan. And the x-rays, cone beam, the cuts of the cone beam get put in, the cuts that are relevant. You don't need every single cut. Just put the cuts that are relevant, the STL file, the photos, all the other data, medical dental history, and have it, do the diagnose and treatment plan and give you recommendations. And what this does is again, it's a second set of eyes. And it's like, as I said earlier, it's like the thousandth opinion because it pulls informations from all the research articles and textbooks and cases. So this is a little bit of a preview of what that's going to be looking like, where there's going to be more features that you'll see on the bottom, but we're trying to make it so that there's not so many buttons and you just speak to it or you just type in what you want. So maybe you want information about your office, your revenue. So you could ask it, what's my year over year revenue, year to date, last year from this year, this time, compare how I'm doing. Then you can say, act like an expert, forensic accountant and tell me how I could improve my efficiency and my bottom line. Things like that. Which patients do I have that are ready for a dental implant? Which patient has missed a cleaning in the past, their last 2 cleanings and is due? Could you pull them up, please? Send them an email saying that they're due for a cleaning. All right, so this is the intraoral analyzer. This is the insurance eligibility check where you put in their information, the MPI number, and it'll just check their insurance, see exactly what their coverage is and what it is now. So, we want to know now, they're constantly changing what coverage is, and you never want to get like 3 months ago's information or even longer ago's information. You want to know what's the real time, what their insurance is saying without having to pick up a phone and call them. So that wastes a lot of time. Now, so far, we've been really, really fortunate that we've seen a lot of great traction, excitement, energy. It's really a movement and a momentum that we never saw coming, and we're really grateful for everyone's support. I think it comes from the fact that it's time for dentists' lives to get a little easier. We're burnt out, our mental health. We're definitely not in an easy field. It's a physical field, it's emotional, there's tough patients, and we want to really create things that are really improving dentists' lives. That's what we're starting with. In fact, everything that we do is what's the next important thing that will help a dentist's life. So that's the order that we go, because that's what we're trying to find and help people. We're blessed to get really 6 world-class advisors. We have 30 plus ambassadors. We have 4,000 plus users already from all over the world. We've logged in over 50,000 messages in about 2.5 months. We have a support center, a data mining center. We're growing at about 300 users a week. We haven't spent any money on marketing yet. We've raised $6 million. Really, most of it was in that first 45 days. And 90% of them are dentists or in the dental field. And that says a lot because we got no money from any venture capitalists. We don't want any other, influences affecting dentists because the venture capitalists, they are looking only for a profit and for how they can make money off of it. And on purpose, we've ignored a lot of emails and calls and people wanting to give us money from venture capitalists. And it's time that we protect our field And that makes me really happy to be able to know that we're really fighting for dentists. Um, and the reason is because we are dentists. We have two co-founders, which I'll talk about. As a periodontist, and my other co-founder is a dentist, and one of our main advisors, actually all of our advisors are dentists. We're a dentist company. In order to make this all happen, though, we do need really a chief executive officer, a chief technical officer that knows AI better than anyone. Really world class, and that's what Dr. Bernard Cass brings to the team. This is his third AI company. His previous one was self-driving cars. The one after that was robots that are used in millions of different robots across the globe. Um, he he really gets it and understands it. And our the co-founder, Dr. Patel, he is from went to school in England, went to UOP, multiple office owner, and really sharp individual who again wants to change lives. And he's really big into child labor and solving that crisis of child trafficking. And that's why actually our company, 1% of our company is going to be going towards donating to child trafficking and to help reduce it. We believe that it, and also Dr. Michael Worley, who's one of our advisors, I'll introduce you in a moment. That's him right there on the left. He's really big with helping children. When we went to his center in Mexico, we were only there for a couple of days, but we went for 3 hours to an orphanage that he helps and supports really. So he's just such a remarkable person. And he has a implant training institute. And he's from Texas. Dr. Marty Jablow, who is America's dental technology coach. Really one of the most knowledgeable people in dentistry when it comes to dental technology. We have Dr. Shankar Ayers, who is, I think he does like one big symposium a week, all around the world, and training dentists on dental implant placement, and remarkable person, traveling all over the world all the time. We have Dr. Stephen Feit, because he's a prosthodontist, and what he brings to the team for the past 30 years, he's been an expert witness defending dentists. And he says that out of the ones that went to trial that he's helped support and defend, he got 60 out of 60 of these dentists off. So he has a perfect record. And so very good person to have, especially in making sure that everything that we're doing is compliant, everything that we're saying, all the information that we're giving is trustworthy. We need to have the top of the top person in the country, and that's what Dr. Feit brings. We have Dr. Eric Pulver, who is on the innovation committee at the American Dental Association. He's an oral surgeon practicing for several decades, just a good human being, and he has a really big love for AI. He's been in the AI space for many years. Really nice guy. These are where our users are, the countries that they're in. Where the darker it is, that's the more concentrated. So we're, as you can see, really spread really quickly. And why? Because our chat is free. Dental education, dental information, this technology will always be free. And the access to real-time information should be free. And that's almost like a right for dentists to have. They shouldn't be held hostage to their dental school, and students shouldn't just have access to, YouTube or Google. They should have this amazing, quick, real-time technology always. These are how we track some of the conversations to make sure that we have good quality assurance. So what does this mean for dentists? Like what is this? What do we just see? What we're seeing is uh, really more control. We're seeing what we call it, what I love the word, what you're seeing him do with his hands, it's an orchestration. So everything is flowing with each other in the dental office. Data is shared between different departments um, and the data is seamless and quick and for natural language to happen, for you to be able to just type in something and say, give me this, it has to access so many things at the same time. And that's what really we're empowered with. And there's so many, ideas, and we're open to ideas. We're getting emails and messages from people that want to work with us, have ideas, collaborate with us. We're very open to that. And we're excited. We like when people, we see people excited like us as well. So what's next? We're gonna be doing more predictive risk scoring. So understanding, about, let's say this tooth has been mobile for 5 years, and it's the same mobility, but they go to a new dentist and the dentist sees, oh my God, this tooth is wiggling so much. Well, if there's not that much pockets, the gums aren't inflamed, that tooth might be able to stay in that mouth to the end, for all you know. But if they don't have the data of if you don't know where someone's been and the rate of how they've been moving, when you look at that mouth and that tooth, you just say, "Oh my God, that's this class 2 mobility with furcation. They're not going to be able to keep it clean. Let's take it out right now." And so this is what creates trust in our field. When they hear you say, "You know what? Our AI is now able to track, and you know what? We're going to keep an eye on that tooth. We don't, that tooth may be, able to be kept for maybe a few more years or 5 more years and hold your partial denture. Because if taking that tooth out and all of a sudden they need to do partial denture, it can make their life a little bit more miserable." So this is where we're going. The whole full insurance workflow, full virtual receptionist, everything basically that a dental office can provide. Now, how could you join? How do you want, to get involved? First, you want to try out the chat, add it on WhatsApp. You scan this QR code for the Global Summits Institute. You take a picture of this right now on the screen, and you get any premium feature that comes out. You get 15% off for a year. And you can go to this website where the tiny URL, that one, or just take a screenshot, take a picture of the QR code, and it'll take you right to where you want to be. It's free to join. And that's one of the big perks is you don't have to pay anything. We don't want your credit card. Just give your email address, put your phone number so you could use the voice that I showed you, and that's it. So with that, if you want to contact me, this is my email address, on Instagram as well, dental surgeon, where I have been, on for I think a decade or so now. As my career has evolved, I was posting and doing a lot of dental surgeries. Then I got into more systemic oral health with COVID, and now the next revolution is AI, and I want to make a maximum impact on the world. That's one of my missions, and for that, you have to really be what is the most important thing in the world that relates to dentistry at that time. Uh, and before it was COVID, and now it's AI. And I know Dr. Shah is smiling because he's on the same wavelength. He is, one of on the frontiers of dental AI. He saw it also before everyone else. He's created a dental AI organization that's all around the world. He has a beautiful, like, huge network that is growing rapidly, trusted from Saudi Arabia to Latin America, and he's a builder of people. He's a connector of people, and we're happy to have you in dentistry. So thank you for having me.
Thank you so much. A couple of things. Yes, we are really thankful for everything that you're doing for our colleagues and the profession. I'm very fond of this concept, given that our institute, the Global Summits Institute, which is currently in over 160 countries in terms of constituents, benefit from tools and techniques that create independence from third parties where they have autonomy and the best kind of advice for building their career and all the tools at their disposal to provide better patient care, making our lives easier because our profession has been taken from us by all these third parties over the past 5 decades. But this tool can really, really democratize dentistry across the world, and I'm really hopeful to see that you guys build in those management features. In fact, I wanted to ask you, I haven't seen anything like it in any other industry, and I spend a lot of time on the medical side of things with MDs. I think that if you guys build this structure, you'll pave the way for many other industries in healthcare and otherwise to utilize this concept to better their professions and their services. Um, so thank you so much for your description. I was very fond of the soap thing because I spent a lot of time on notes, and that's very annoying. I have to stay at the office for at least an hour every time
Yeah.
to document, and it's torture. And half the time I don't get all of the things that I said to the patient in there. But if ISEC is translating it and documenting it, that's a good for liability
Yeah.
reasons also that, hey, this patient was stated so and so.
Yeah.
That plus the scanners, that's going to be amazing. I'm
Yeah.
very excited to build it in. So, thank you for the offer you guys have extended to the viewers today. I highly encourage everyone to look into it and get started. This is actually a great first start for somebody that doesn't have advanced skills in AI, which I get asked at every conference, at every podcast. It's always the same thing. Where do I start? And this ISEC can be your best friend and give you unbiased, selfless advice that you can benefit from. Dr. Shervin, I would love to have you back again for another event as an update. Are you guys have any kind of schedule for a rollout plan of all of these apps you guys are adding?
Yeah, so we're rolling out the entire patient management system at the Greater New York meeting around December. So I know you're going to be there too. We'll also have an event there, and then we'll do another one in Chicago. And really, we want to just get it out and let people see it.
You're at Midwinter? You going to Midwinter?
Yes.
Oh, I'm speaking on AI there.
Oh,
So I look forward to seeing you there as well.
yeah, great.
Okay. Well, we're gonna have you back probably in 4 to 5 months to see where we are at with Trust. And thank you for everything that you do and have done so far. And we look forward to our continuous collaboration. Thank
Thank
you.
you so much. Thank you. Thank you, everyone.